this next edition of our webinar series on ethics and COVID-19. On behalf of the Milken Institute School of Public Health at George Washington University, and particularly the Office of Research and the Bioethics Interest Group here, we are really delighted to start. This is our 12th webinar. And actually, with this webinar, we are launching what we call a global tour. And we'll be covering different regions around the world. And I'm so delighted that we are starting this regional coverage today with East Asia. And I'm particularly gratified because I know what time it is in East Asia. It's probably close to midnight. And yet we have our two amazing colleagues who are going to grace this occasion and talk to us about the concerns around ethics and COVID-19 in their countries. So thank you all for joining. Please remember that this webinar is being recorded. We will use the chat board for having your questions, your comments, and your reflections. I know that some students also join as well. If you need continuing education credits, please let my colleague Lawrence Kennelly or Paul and Debele know, and we will ensure that your forms are also highlighted. So as I was saying, COVID-19 has unveiled a myriad of ethics issues all around the world, including those that deal with prevention, with cure, with policy, with treatment, with vaccines, and we've had the opportunity to cover many of them. However, we recognize that there are regional differences in some of these issues, and so I'm really delighted to launch our global tour with East Asia, loosely defined, and I'm very excited to welcome Drs. Calvin Ho and Yonghui Ma to our webinar. I'm going to actually start off by requesting Professor Yonghui Ma to provide opening reflections. Dr. Ma currently works at the Center for Bioethics in the Medical College at Xiamen University. She is actually a bioethicist. She's done a lot of work on everything from neuroethics to cross-cultural bioethics. And she studied and trained at various countries around the world, particularly at the University of Manchester in the UK. She's now working in the Center for Bioethics at the Medical College at Xiamen. And I'm really, really thankful that despite the very early hours of probably what is now after midnight, Yonghui, you were able to join us. Could I ask Michael to stop sharing this slide, and could I request Lauren to put up Yonghui's slide set? Yonghui, can you hear us, and can you go ahead and provide your opening reflections?
Yes, thank you very much, Adnan, for the wonderful introduction. Can you hear me?
Yes, loud and clear. Please go ahead. Good,
very good. Thank you very much. It's such a great honor and opportunity to speak on this webinar. I will talk about the ethics and COVID-19 from a Chinese perspective. Next, please. Next, please.
Yonghui, we are looking at the outline slide right now. Do you want the
All right, okay, good. My talk will be divided into two sections. First, I will briefly introduce you about the China's measures against COVID-19, and then we will explore and examine some of the ethical and social issues in Chinese response to COVID-19, and I will identify 3 areas of the major ethical concerns. Today, the world is experiencing a pandemic caused by a novel coronavirus, COVID-19, the third disease from a coronavirus to cause a global outbreak after severe acute SARS and Middle East respiratory syndrome, and the second that emerged from China. The last one was SARS, dating 17 years ago, also identified in China. We can see that in the earlier of this year, COVID-19 was first break out in central China in Hubei province, and the capital city Wuhan. Wuhan was the epicenter of the epidemic, and COVID-19 occurred around the time of annual Chinese New Year holiday billions of residents returned to their hometown to celebrate the New Year with their families, which is a tradition in Chinese culture, and greatly increased the personnel mobility and traffic congestion in the short term. Wuhan is also the coal transfer hub of China's transportation system, which connects most of the regions in China. And only after 6 months until now, that on the 14th September, we can say that most places were cleared with no incidences, no new infected cases. And we can say the epidemic is substantially under control in China. The State Council Information Office of China released a white paper, Fighting COVID-19, China in Action. This white paper shares some of the effective measures in fighting the virus. Also, the document details China's rapid mobilization and response in building a nationwide prevention and control system. China has carried out rapid social mobilization across the whole country, adhere to the law, use scientific and precise prevention and control measures. And in this white paper, these are the measures controlling the source of infection, gave priority attention to the 4 groups: the confirmed cases, suspected cases, patients with fever, and close contacts to patient, cutting off the channels of transmission, suspended public transportation, residents restricted at home, closure of public places, the basic line of community defense, food, medicine, and a lot of supplies was uniformly distributed to resident committee members, establishing a dynamic management system and effective rule of law guarantee respecting scientific rules. At the same time, 2 hospitals were built up in 10 days. The Huoshenshan and the Leishanshan Hospital, which provided approximately 2,400 beds. And there are also 14 Fangcang shelter hospitals, which is a novel public concept for the medical observation and treatment of more than 14,000 suspected cases, mild patients, and close contacts. They were implemented for the first time in China. And they were actually rapidly built by converting existing public venues, such as the stadiums and exhibition centers, into healthcare facilities.
Dr. Ma, which slide should I be on right now? I just want to make sure I'm lining up. I'm right now on the white paper, China's rapid mobilization. Should I move ahead?
I think I am sharing the slides. I think it's me sharing the slides.
No, I think I'm controlling them right now.
Oh, sorry. Sorry.
No, that's okay. That's okay.
Now you see the ace.
Okay.
Oh, I thought I'm controlling the slides.
No, that's okay. I'm controlling them. So should I be on the white paper slide or the?
No, you have to jump. I think you have to.
Okay, that's fine.
Yeah, Yongwei, I think Lauren is doing that, so she just let her know which slide she should be on, and we can continue.
The eighth one. The next one, please. Oh, yes. Yeah, this is the one.
Okay.
This one?
Yes. Yeah. No, okay. The previous.
Okay. This one, the whistle giver?
No, the previous one, the eighth.
This one?
No, can you go back?
Yes.
Lauren, that's it, Lauren. Stay on whistle, I think. Yeah, that one.
No, can you just go back to, no, not this one. Can you maybe you can just let me to control.
Okay, Youngwi, do you want to present your slides from you? Then we can stop sharing from here. Do you want to share your screen?
Yeah, please do. Yeah. Okay, I think
Go
that's
ahead.
easier. That's easier for me to share.
Folks,
all right.
about this, we usually have this sorted out, but we'll get there. Just give us 1 minute.
Yeah, can you see the slides?
Yes.
Okay, good. And a lot of medical teams are rushing to central China, Hubei province to help the coronavirus control. The city where I'm living in, the Xiamen, city of Xiamen, on the 10th of February, a team of 264 medical workers from 10 hospitals run by the Xiamen Health Commission flew to WUHAN, capital of Hubei province, to join the fight against the coronavirus epidemic. And in total, there are more than 42,600 medical staff to Wuhan city and Hubei province, ensuring the adequacy of medical resources in the epidemic area. So as we can predict that we also received the praise from the WHO, said China had rolled out perhaps the most ambitious, agile, and aggressive disease containment effort in history. And there are also a dramatic decline in new cases across China. But in these public health measures, there are also the ethical and social issues in China's response to COVID-19. There are the isolation and quarantine concerns. Some people question the necessity and proportionality of the measures in some places with very low epidemic. And there are also the issue of lack of transparency, especially in the earlier stages. And the China's mobilization and the nationwide people's war, use of digital technology, which raise issues of data privacy and confidentiality. And I will focus on these three issues. We know that transparency is a key principle to let citizens know how to protect and to let medical and public health personnel know what kind of interventions should be taken. However, there was a lack of transparency earlier in January. On January 28th, a special report titled "The Path of No New Cases for 12 Days After January the 6th, published in the online journal e-magazine, said that strangely enough, from January 11th to 16th, the number of confirmed state cases in Wuhan remained unchanged at 41. As this picture you can show demonstrated that the number has not changed. The lack of reported new cases raised the suspicion that true information was being hidden and that the public was misled and missed the opportunity to control the spread of the virus. The author reported that during that time, 2 meetings were held in Wuhan, the Hubei Provincial People's Congress and the Political Consultation Conference. These are 2 very high-profile conferences. Hubei Daily published a special report with 12 pages to praise the achievement of the government. In the lower corner of the last page, there was the information on the epidemic issued by Wuhan Health Commission. By that, notifications made only on the following points: that all patients were receiving isolation treatment in medical institutions, no clear evidence of human-to-human transmission were found, and no medical staff members were infected. According to one of the pioneer bioethicists in China, Ren Zongqiu, he said publicly that this is a case in which public health intervention was devastatingly compromised by the politics. And actually, people's anger was reached the peak by this man's death. The whistleblower, Dr. Li, He was detained by police for alerting the public to the virus in November 2019, died of COVID-19, triggered significant public anger and frustration at the Chinese authorities. His death became the top trending topic on Chinese social media, garnering an estimated 1.5 billion views. He said that he thinks a healthy society should not have just one voice, and he was actually one of 8 people detained in WUHAN for spreading the rumors. There are also obituary can be found on the Lancet. There's another lady. She's also the chief director of the emergency at Wuhan Central Hospital. If we call Dr. Li the whistleblower, and then this lady, she's the whistle giver. She was among the first people to bravely spoke out after seeing several of her colleagues died from the coronavirus, criticizing hospital authorities for suppressing early warnings of the outbreak in an interview. But she got reprimanded after alerting her superiors and colleagues. This article also clearly was repeatedly being erased on the internet. And the article illustrated the severity of the epidemic in Wuhan indirectly, which was far worse than those from the official propaganda. The article quickly disappeared, but those inspired Chinese netizens have reconstructed this article in creative ways, such as traditional Chinese calligraphy, Morse code, emoticons, and this is a picture showing the creative ways to trying to reconstruct this paper. The second issue I want to talk about is the Chinese people's war on COVID-19. This mobilization system is based on the Maoist People's War doctrine, which relies on China's size and people to defend the country from attack. In this whole of society approach, everyone in the society play a part. We know that in the context of China, communities are the cells of Chinese society, usually referred to as the communities in urban areas and villages in rural areas. The Chinese society is administered by a top-down hierarchical governance system, which is composed of 5 levels of governments. These 5 levels. The communist members are identified to be the most influential and the most trusted, and these people show the effectiveness in mobilizing the people, challenging that because some of the people are having difficulties at stay at home, and they created ways to persuade them to self-isolate. China's all-out war against the coronavirus has many weapons. There are quarantines and lockdowns. Nearly 500 million people have been confined to prevent the spread of the virus. And there are also these red banners, which I think is very, very Chinese. And there are also some aggressive measures of to block the mobility in the rural areas. The red banners strung across the streets and in public places with rhyming Chinese slogans have been a part of government campaigns for decades in China. Some of them during the pandemic are unpleasant, offensive, and discriminatory. For example, better to wear a mask than a ventilator, better to stay at home than in an ICU. Those who gather together are shameless, those who play mahjong are daredevils. And there are also this year a house visit, next year a grave visit. Those who do not report their fever are class enemies, hiding among the people. These banners locate COVID-19 not only as a threat, but also as a threat to the body, to the health, but also a threat to the states, and blame at sick individuals for failing to take precautions to prevent the spread of the illness. For example, returning to hometown with the virus means you are unfilial. Passing the virus to parents means you are utterly devoid of conscience. In this kind of messaging, coming down with a disease is represented as a moral failing, and which also promote fear. We know that fear is a very dangerous thing in an epidemic. The use of this fear to drive positive health responses from the public is a double-edged sword, because people would like to hide out and do not seek treatment. The last issue I want to talk about is this China health code system. Relying on mobile technology and big data, the government has used a color-based health code system to control people's movements and curb the spread of the coronavirus. The automatically generated quick response code, commonly abbreviated to QR code, are assigned to citizens as an indicator of their health status. A green health code allows you to move around freely, while amber or red requires self-isolation. The advantage of using this system is obvious because it allows health authorities to track COVID-19 by monitoring individual interactions within large mobile populations. Give one example. If the status of an individual passenger on a bus changes from green to amber, the colors of all the other passengers also change. These are the QR code from my cell phone, and I visited my parents to Xinjiang, the northwest part of China. But when I come back, that this is my health QR code, and this shows my travel history. It shows that the last 14 days, the places you have visited, Xiamen, and this is the Xinjiang Uyghur Autonomous Region. And this is my health report, which can also generated from my smartphone. And when I landed on my hometown, there's a lot of, you need to scan this code, and then your health status will come out. However, when a country rolls out such a one-size-fits-all system, some citizens are bound to be left behind. While much of the elderly population in China owns smartphones, there are still some who have never owned one, especially in rural areas. And actually, there are about 250 million people in the country lack the skills to use a smartphone or do not use one. The health code system that the Chinese government has developed in response to COVID-19 builds on long-established traditions of population surveillance. One crucial point that the discussion seems to be missing when it comes to health code is data privacy issues. Living in China already requires users to give up their private data daily, because when you registered with your WeChat account, you need to provide your ID number, and a lot of other personal information. So a health code system serving such a noble purpose does not seem to be too great of a leap. There are also some of the examples that elder Chinese people who cannot show their health status, their QR code, are forced to walk miles to his relatives because they were banned from public transport. And there are also other people who are trying to sell the vegetables, homegrown vegetables, but they does not have a QR code. So they get frustrated when they were asked by consumers to show the QR code to make an online payment. There are also the variations of this QR code. Authorities in the city of Suzhou, west of Shanghai, introduced a new function designed to measure a person's civic performance called Susceptibility code. It is aimed to encourage people to follow traffic rules, take part in voluntary services, sort their trash, and do other things that make them model citizens in the eyes of the government. Those with a higher score could enjoy some coupons or vouchers, discounts for public transport or film tickets. But there are no public consultation before its launch and no feasible ways to guarantee its implementation. Here are the ethical concerns with the QR code. First, the data privacy and confidential issues. How identifiable the data in relation to particular individuals were collected. Health codes require identity card details as well as full face scans as well, and the travel history. In China, there's a strong sense of social responsibility and solidarity. So a lot of people does not questioning or have a high awareness of the rights to privacy. There are also informed consent issues. The public need to be informed on what data will be collected and how they will be utilized. Public consultation engagement in discussion on principles and measures of data protection is also very important. There are also the ownership of the data. Who owns the public's data? Whether the data will be owned by commercial technology companies like Alibaba or public health authorities. There are also the potential, the risk of exploitation on vulnerable groups, especially the Uyghur Muslim populations, and under full face recognition applications. For political aims, there's also surveillance. The other panelist, Professor Calvin Hall, described the use of such mobile technologies as a form of mass surveillance. There is less institutional oversight for surveillance, which means app-based surveillance data and research derived from it may not undergo ethics committee reviews. We know that there is a research ethics regulations on the research involving human beings, involving human subject, but there's no RRB review on the data generated from surveillance. I think I can wrap up now. Some people say that COVID-19 is an end to globalization, but there are some other people say we need to cooperate and we need leadership, and this is vital to defeat the pandemic. And I believe the latter. All right, that's all from me.
Thank you very much, Dr. Ma. Thank you very much for a wonderful review. And I want to appreciate both, I apologize for the IT issues, but also appreciate your candor and your frankness in this. And so thank you very much for reminding us about things like transparency, about mobilization of individuals, and about digital privacy issues, which we'll come back to. I'm now honored to introduce our second speaker. I'll request him to start putting up his slides as I introduce him, Professor Calvin Ho. Calvin is a lawyer, he's an ethicist, he's got so many degrees, it's difficult to even enunciate them. It's my real pleasure. I've known Calvin for a little while, and he has done a tremendous amount of work on the intersection of law and ethics, first in Singapore and now in Hong Kong. Like Professor Ma, he was trained in many different institutions, including Cornell University here. I think what is important for me to identify is that Calvin has been working with organizations like MSF, Médecins Sans Frontières, and so he brings with him not only a sensitivity to the region, but also global bioethics. So over to you, Calvin. Looking forward to hearing your reflections.
Thank you very much, Professor Adnan. So just to be sure that everybody hears me well, all good? Thank you so much. So thank you again, Adnan, for the wonderful introduction, and I'm very delighted to be part of this webinar series, and certainly delighted to be speaking together with my colleague, Professor Yonghui Ma, who has given a wonderful presentation and certainly points that I'd like to build on as well. So greetings, everyone. Thank you so much for joining us. If you're wondering what tomorrow looks like for you, well, this is sort of a glimpse of it. So it is already the day after, I think, by US standard. But and I thought that it would be wonderful to share a bit about some of the developments that are likely to happen. You've heard about how COVID started essentially in East Asia. I'm going to try to speculate about some of the things that will follow. As we've heard from Professor Ma in her presentation, what COVID has done in a lot of places, including East Asia, would be to highlight the many fault lines in our health system. And I think it's beyond just the health system, but more broadly, including our social systems. So my key message, just going to get to the slides, okay? And so my key message is just essentially this: is to pick up essentially on the last point that Professor Ma mentioned. That is essentially an acceleration of digitalization that we find, and it's not just limited to health. But let me just focus on health and public health, and to highlight some of the issues, particularly that relating to accountability and the need for greater transparency in terms of how data is going to be integrated within systems. Of course, for those of you who are already familiar with developments in East Asia, particularly the health and more broadly health research policy, there has been already a lot of emphasis in countries within the region on digitalization at many different levels. So, so what we'd find in COVID is essentially a greater push in that direction, and we'll find that this pandemic has also given a sense of need, as well as legitimacy to a number of initiatives that have been put forward before the pandemic outbreak. So just to look at a number of developments in Hong Kong, of course, following the outbreak in China, that mainland China that Professor Ma talked about, Hong Kong introduced a number of measures, and these measures are essentially not new. So we have, by and large, in Hong Kong, been rather effective in controlling the number of local cases. In fact, it's been a bit of a back and forth situation with just, I hope, come to near completion of the third wave, essentially. So, and of course, following from that, there were a number of interventions taken up. Most recently, mass testing of actually 1.7 million people now. Of course, there's some debate as to whether it's the most efficient use of resources, having testing done at this stage, mass testing in particular. But of course, again, putting that debate aside for the time being, I think it's helpful to point out that from this mass testing, we haven't picked up that many cases, which does seem to point to rather effective public health measures, the more conventional public health measures that have been put in place before. So of the 1.7 million people tested so far, we've only picked up about under 40, as I understand it, under 40 silent cases in the community. So that, I think, is itself an indication of public health measures done relatively well within the territory. And there are a number of reasons for that. Of course, apart from the conventional public health measures put in place, there's been evidently the use of contact tracing apps, and this is not confined to Hong Kong. Professor Ma has mentioned the app that was used in China, and she has also explained how on the mainland itself, there's been quite a bit of variation in terms of the construction of the app, the way that it's applied, and of course, by and large, generally similar features. But of course, one of the big point to note would be whether it is here in Hong Kong or on mainland China, there would be data being collected, and we also see this in many other East Asian countries. So we see that in South Korea, in Taiwan as well. Interestingly, in Taiwan, the officials there have come forward to say that post-COVID, they are going to delete all the data collected due to privacy concerns. I haven't heard a similar kind of assurance being made anywhere else in East Asia. So So apart from in Taiwan, of course, you have the use of this app. We find it in Singapore as well, and also beyond East Asia and close to us, of course, in Australia and New Zealand. What might be helpful to highlight would be, of course, in East Asia, by and large, general population tends to be prepared for this pandemic because of their experience with SARS. So nobody really would question a lot of these measures being put in place. In fact, in Hong Kong, people just took on the initiative of putting on face masks, for instance, without actually being told by the government to do so, for example. So a lot of these precautions were taken up. And in South Korea, of course, quite apart from the rather, I think, situational kind of transmission that we saw initially for COVID, we find, of course, in South Korea, they've got prior experience with MERS as well. So that, in a sense, prepared them to cope with dealing with this particular pandemic, and as we've seen, quite effectively. So by and large, quite different from a number of concerns that we're seeing in Europe and the US, for example, in terms of very overt and very open discussion about privacy concerns. Of course, as Professor Ma mentioned, it's not to say that privacy is not a concern in East Asia. It's just that I think given the appreciation of what a pandemic is going to be like and the sort of drastic measures that need to be put in place, people were prepared to compromise on this particular aspect, and they were quite by and large prepared to accept the sort of privacy risk, in a sense, or compromises that might follow from the use of this app. So what's interesting to follow, I think, the post-COVID situation will be the use of these sort of data that's been collected, and of course, the continuing push towards digitalization. Of course, and this is just the situation in Hong Kong, but we will see this in just about all of the other East Asian countries, a greater focus on telemedicine, on mHealth, on e-health, on digital payment, and of course, the digital workplace more broadly in terms of how our workplaces are being transformed and even work situations. So with all of these sort of developments, there will be an even greater need, I would think, in terms of how these sort of data is being collected, being used, being processed, and applied towards what might be, well, public interest or public good sort of endeavors. Of course, there would be a number of justifications for such rather broad use of data, essentially to achieve public health goals. So in the 2017 WHO guidelines on public health surveillance, I thought it has very helpfully set out a number of ethical principles. So these broad ethical principles would not be disputed in any sort of place, I would imagine. But of course, what's going to be challenging will be to understand how these particular principles are going to be expressed. So what's interesting is that in Hong Kong, if we think about respect for persons, at least in relation to privacy, there is a particular law that applies to it. Of course, this would be broadly based on the UK Personal Data Protection Act, so what we call the Personal Data Privacy Ordinance here. And on the mainland, as I understand it, what's really interesting is that there is also provision on privacy. It's not overtly called privacy. In the civil code, it's seen as essentially a personality right, or what they call 人格权. So it's interesting in terms of seeing how these particular values are being articulated and implemented in different places. Moving forward, I do think, and also building on this particular report, there will be a greater need to think very seriously about the intersection between public health surveillance and research. As Professor Ma mentioned, there would be review mechanisms, well-established ones, when we're talking about research. But when we're talking about not just surveillance, but a lot of public health work, epidemiology, for example, it's not subject to any overt sort of review. Of course, by and large, we'd say that since the epidemiologists essentially work with aggregated data, it's not going to be a serious privacy concern. But of course, as we move rapidly to the age of big data and the ability to relink information that we think has been de-identified, I think this might pose severe challenges in terms of how we should continue to sustain public trust, as such data is rapidly being used in many different domains beyond what might be public health. So I think a very helpful point that WHO has highlighted in the guidelines relate to particular susceptibility or vulnerabilities. So in terms of the sort of development that we see in COVID, and some of the points that Professor Ma has very helpfully highlighted. So if we think about these sort of situations, and then if we are to think about a number of post-COVID sort of development that are likely to follow, I think it'll be challenging for the bioethics community to think about or to rethink about susceptibility, about vulnerabilities, and how to address them in a way that could sustain public trust and have in place greater public accountability. So I think these are some of the challenges that we can anticipate. I think they're very big challenges for our region in East Asia. And again, I don't think this is something that we can manage just in countries or at a country level within this region. And I do believe that it must be a collaborative endeavor. So my concluding slide here would be just thinking again about COVID. Because what's unusual about this situation is that many health systems have used the most drastic intervention at the start of the pandemic, which would be a lockdown. Because for those of us who are familiar with the international health regulations, that really is the most drastic measure on the list that should be introduced. But of course, that having been introduced, as we've seen, has contributed to quite a few harms, some of which are very vividly illustrated by Professor Ma. And I think, of course, within our own settings, we would also be familiar with them. So we would want to, or thinking beyond COVID-19, to think about how we could avoid a similar situation from occurring, but at the same time also anticipate a number of changes that will follow, but in a way that we need to be involved in building the sort of trust and trustworthiness, as well as the sort of community engagement that is needed, because I guess one of the fallout of this particular pandemic would be, I think, the continuing erosion of trust, given the many kind of problems that we have seen, both within our health systems and also in the global health forum. So with this, thank you very much for your attention. Happy to take questions, a short glimpse of HKU if you haven't visited. Thank you again.
Wonderful. Thank you very much, Professor Ho. This is great. I appreciate very much your coverage of some of the key principles that you work with in Hong Kong and the surrounding countries, including the notions of equity, justice, and common good. And thank you for raising issues of surveillance, in particular, in a post-COVID world. So ladies and gentlemen, we do have a few minutes now, very importantly, to discuss issues. And we have both Professors Ho and Ma available. I really want to start maybe by going to you, Professor Ma, and just talking a little bit about something that I think has stimulated at least a couple of folks on the chat board, which is this notion of using cell phones and QR codes and tracking people. And what happens when either people have multiple phones, or when an individual, for whatever reason, may not have one. What happens to those types of populations, and in particular your concerns around tracing of those movements? So any thoughts on that, Dr. Ma?
Sorry, there's a moment that the internet was lost. Can you just repeat your question, please?
I just wanted to say that on the chat board, there are folks asking around how, what are your thoughts, particularly with respect to populations that may have either no phone, in which case, how would they be tracked? And I don't know if such people exist in the context you work in, Or if people have more than one phone ascribed to them, how would you track populations and your perspectives on that?
For most of the Chinese, the vast majority of the Chinese people, you have to use your ID number is related to one number, to one cell phone number. So most of the people only have one cell phone number under their names. And I know there's a lot of complaints on the technical bugs, and I know some of the people can get bypass the QR code and can cheat on it. But there are also some other people who have never been to the high risk areas, but their QR code showed red.
No, thank you. And Calvin, can I bring you in on this conversation, particularly because I know that in Singapore, one of the more recent outbreaks was in migrant populations, for example. So are there populations that you miss when you use digital technology like this, so-called for the greater good? But are we missing, migrants or other types of populations that you may come across?
Yeah, thanks very much, Adnan. So as you've mentioned, that is a huge concern in terms of whether certain populations are not, for example, having access to particular types of technologies. In fact, Professor Ma has mentioned also in China that there are certain populations that do not use mobile phones, for example, and therefore, as we've seen, there was a very good account of how an individual's well-being has been, in a sense, impacted. And as you've mentioned, in Singapore and also here in Hong Kong, there's been some very serious concerns as to whether individuals without access to these sort of technologies would, in a way, be compromised in terms of their well-being. But of course, by and large, what I think very helpful to note would be, just leaving aside for the time being marginalized populations, and that I fully agree is a huge issue. Just to get to Paul's point, thank you so much for that point, Paul. What has been, I think, quite heartening would be a demonstration of very solidaristic or communitarian kind of actions. You'd see, like, for example, if individuals haven't got face masks with them, other individuals who have got extras would share this with those individuals to say, you better make use of this. And here we might just as well be talking about strangers. So that's where you'd see it being, in a sense, exhibited within, of course, the community. Although, as you've noted, one of the problems is that, in a sense, the big question, who exactly would you count as your community? And then, of course, then what do we then, or how then should we think about these marginalized groups, which for whatever reason may not be seen as part of the community or somehow being cut off in the process?
No, thank you very much. And thanks for addressing that point. Professor Ma, I want to come back to you because there are questions on the chat board around, what are the ethical criteria that we might use to distribute scarce resources? And one of the ones mentioned, for example, is being talked about is vaccines. Have you, moving ahead from some of the issues you've raised, would you like to make a comment on how do you think, if and when a vaccine is ready, what are your perspectives for your country and region in particular in terms of its distribution?
I heard that there's some news that the development of the vaccine in China is halfway, and I think it is under the phase 3 experiment trials. That there are discussions who will be the people to get the priority on to get the vaccines, and there will be most of them would be the health professionals, those clinicians who have a high exposure to the risk and to the infection. And there are also the personnel working on exit and entry on the borders, and some of the drivers basically these are the people who have a high possibility of exposure to the transmission.
Yeah, no, thank you. Those are great examples. Calvin, I want to bring you in on the same question because you've raised, and actually both of you raised, the issue of trust. And so even with the distribution of the vaccine question, there are going to be issues on trust, even if you have an explicit set of criteria. What are your perspectives from your work in Hong Kong and Singapore on this?
Yeah, thanks very much, Adnan. So I think there's still quite a lot more work to be done on the trust front. I guess, you know, it's, I guess you've seen the news is particularly complicated in Hong Kong. I don't think it needs to be illustrated further. I think what's interesting is that by and large, again, going back to Paul's point, the general public in Hong Kong, thanks to the experience with SARS, they by and large have been very mindful about the sort of measures that need to be put in place. So we're hoping to prevent a situation where the health system itself becomes unable to cope with the sort of challenges. And of course, in terms of the vaccine question that you've mentioned and allocation considerations, I think by and large, the policy, whether it's in Hong Kong or in Singapore, it will be based on the WHO guidance that was developed following SARS. So there is a set of ethical considerations broadly outlined by Professor Ma in terms of prioritizing frontline workers and, of course, vulnerable groups, and then having proper triaging policies. These are, I think, broadly indicative of the measures that we have in place. But as for going back to the question of trust that you've mentioned, I think quite a bit of work needs to be done post-COVID. I think at this point, it's still a matter of having social distancing policies in place, encouraging people to take the necessary precautions. But I think following that, and I think these are, again, some points, as Adnan, you'll be familiar with, some points that have been in the discussion in global health forums for quite some time, engaging with vulnerable groups, explaining the policies, and discussing with communities how best to prepare for the next outbreak, because we know that this will happen again. It wouldn't be an isolated thing. So these are some of the things that we will need to put in place. But at the same time, I'm more immediately giving assistance to people who have been greatly affected by the pandemic. So we do owe them, first of all, a responsibility in helping them cope with a lot of the challenges, and then to see how we can progress better together. So I think it's a great point that you've mentioned in terms of the marginalized population, migrant workers in particular. It's not an easy topic to address. So that's something that I think as bioethicists need to keep it on the agenda so that it is not forgotten.
That's correct. That's correct. I couldn't agree with you more. And what is interesting is, Calvin, that's true for every country. So right here in the US, where I work and live, as you know well, there's a disproportionate impact of COVID-19 on African Americans, on Hispanics, on Latinos, on brown populations, on Black and Indigenous people of color. Our unfortunate caseload is in millions, and our death load is now approaching 200,000. And so I think high-income countries can hardly claim that they have been exemplary in their response. And that's why I feel that a global perspective sets you well. So thank you for those words, Calvin, and I'm going to take them as your closing comment as well. So Professor Ma, any final reflections on this issue, and certainly from the perspective of what the world might be able to both learn and contribute to the response from your region?
I just hope there's less blame and less pointing to each other, and I hope more cooperation and more support. And solidarity is very important principle, especially in the face of the global pandemic.
Very true, very true. And I fully support those words. I think it is unfortunate that in the middle of this pandemic, the United States government has decided to leave the WHO in many ways. It's a decision that many of us disagree with. And those types of decisions don't necessarily further solidarity. So, ladies and gentlemen, first, please recognize that both Professors Ho and Ma, and those of you from that part of the world, it's way past midnight. It's already the 16th of September. So I want to thank them from speaking to us from the future. But I also want to thank both of you, both of our panelists today, because they have been very frank. They have used candor. They have used their own insights. I recognize the different cultures and the diversity we all live in. Thank you for being both honest with us and for being brave in expressing your opinions. Thank you all for joining us. I think this is really reminding us how important it is to ask people from other countries and other regions to share their thoughts, because once again, it's tremendous that we've been able to do this. Ladies and gentlemen, exactly two weeks from now, on Tuesday, the 29th of September, our next Ethics in COVID webinar will be on publication ethics, the ethics around publishing papers during this pandemic. I'm looking forward to having an editor of an eminent journal and an ethicist discuss those issues. So Calvin, Younghui, thank you very much. I really appreciate you staying up so late with us. Ladies and gentlemen, this webinar will be recorded. So if you have colleagues who'd be interested in hearing these presentations, we will circulate on our website as well as on our Twitter account, the location of this recording, and we'll make sure we'll circulate it as well. Thank you very much for joining me today. Thank you again for attending. And I really want to thank my colleagues here at GW School of Public Health and the Bioethics Interest Group for supporting both technically and otherwise. And I apologize for the slight technical glitch we had during Professor Ma's early presentation. Thank you all. Have a safe and secure rest of your day. Bye now.